Joins us. Good evening and welcome to the March 6th special meeting of the Board of Estimate and Tax. We are continuing our budget reviews this evening. As a reminder, before we start, for anybody from the public attending, there is no public commentary during these reviews. Public commentary will be held at our hearing later in the month of March, and you are welcome to come and comment at that time. That said, Madam Clerk, may I get you to call a roll, please?
Mayor Rilling, Mr. Abrams,
Here.
Mr. Camacho,
I'm here.
Mr. Constant,
Here.
Mr. Gilleret,
Here.
Mr. Casimis, Miss Yang.
Here.
We have a quorum. There's the mayor, Mr. Mayor. We have 6 in attendance, including the mayor, and we have a quorum.
Thank you very much, Irene. Before we get started this evening, Mr. Mayor, any opening remarks that you would care to make?
No, thank you. I've made a couple of remarks in the other meetings, so I'm good. Thank you.
All right, very good. So, Tom, where are we starting this evening?
Tonight we are starting with community services. I will start to share my screen. And if somebody could give me a check on legibility and visibility.
I do see it. If we could go just a little bit bigger, that might be helpful for everybody. As it gets later in the week, everybody's eyes gets more and more tired.
Yeah.
That's
how's
good.
that?
Thank you.
Okay. All right, just a quick walkthrough, if the BET members will bear with me just for the department heads and chiefs and support folks. The spreadsheet is very similar to what I sent out yesterday and today with adjustments, but basically these 3 shaded columns here are the last 3 years of actuals history. And then over here on the far right with these 2 shaded columns is a 3-year average. So that's just the average of those 3 that we just looked at. And then your request, the difference between your request versus that 3-year average. No need to address this unless there's something large that you would like to, but just a way of highlighting a trend or trends for anything that may need some attention. The key columns that we are looking to speak to tonight are the recommended columns, these 3 right here. The fiscal 26 recommended. There are a number of different modules or levels, if you will, within Munis. We started out with the requested, there's pro forma, and we are now currently at the fiscal 26 recommended, which is reflective of any recommendations from the CFO and or the mayor's office. And then these are the key columns right here. The difference between your 26 recommend and your 25 or fiscal 25 approved number, not the fiscal 25 revised, the original approved adopted number. So in this particular case, it's $1,800 and the percentage is 2.35. Recall that when we started this process back in October, the general guidance was to attempt to keep your increase year over year to 2.5%. So in this particular case right here, we are good at 2.35%. So tonight we are doing community services and the operations, public works, building management, recreation and parks area. First up is community services Lamont Daniels, but we are starting in this particular case. We're going to go in order of the Munis hierarchy. So we're starting with early childhood program development, and I'll turn it over to Lamont if you want to make any opening remarks on your division as a whole.
Great, sure. Thank you. Thank you to the mayor.
Recording in progress.
I just heard some background saying, am I okay now?
Yep.
Yes.
Great, fantastic. So good evening, good evening, board, to the mayor, to all. Just by way of introduction, Lamont Daniels, Chief of Community Services. In terms of, I know we're going to review the budget. This is not my first rodeo, but to Tom's point, and thank the mayor for his support in this process, that my department, which consists of the Human Services as a department, Health Department, and the the library. So while Tom mentioned it's broken out, but those really are the three pieces. And so we're joined here by Anna Vivian, who is the Director of Human Services, Sherelle Harris, a Director of Norwalk Public Library, and also Deanna Diamore, Director of Health, but also some of their team leaders are also will be here if any questions. But we worked really hard to adhere to where we are in our city with our budget. You definitely do see some increases, and we're definitely looking forward to talk about the rationale and the importance of those requests. But again, thank you for this opportunity to share, to even do a deeper dive into some of the things that we do in community services. So with that said, I'll turn it back to the board and entertain and walk through as needed.
Yeah, just before we get started, let's go down to the bottom here and just show you that the overall total for community services is 4.81%. So we can now start going through the individual departments. So here we've got early childhood, very modest, $1,800, 2.35%. Not much of a to discuss there, unless anybody wants to add anything or any questions.
Any questions on fair rent from the board? Okay, I'm sorry, an early
Early
childhood.
childhood, I
Yeah.
think.
I
all right, so-
apologize.
That's okay.
Yeah.
You guys been doing this for I get it.
And now, and now way down to fair rent.
rent.
Only looks like just a handful of things over 2.5%. It's a negligible amount, only $200. Here's well, that's into human services. But before we jump to that, any questions on fair rent?
Not for me, from anybody else on the board?
Is this the category where Margaret Shreve's
No. Right, there's fair housing and then there's fair rent. So this is the fair rent around residents are able to file and have this commission look at their rent, and their commission uses a protocol and procedure to determine if should the rent be increased or not, to what extent. Fair housing is around the discrimination, class action type of activities on the fair housing side.
Yeah, fair rent is next Wednesday, and along with the other grant.
You mean fair
grant
housing?
categories. That's like a harbor commission, fair housing, probate court, transit district, so on and so forth. That's next Wednesday night.
got it. And so the fair rent is under, is it a Department of Housing and
Our structure, if I may, fair rent lives under human services under Anna Vivian Estrella. So she's the supervisor, and the fair rent officer or coordinator, if you will, reports to her, and they oversee that. I would call it unit. I know we get department, but I would consider it more of the unit as far as a department. They live within the human services department.
and your mandate comes from
This is a law that actually Norwalk should take pride in, that we had a fair rent office even before law. So this is, I think, back in the late 70s, and now there's law that any municipality that has a population over 70, correct me if I'm wrong, Anna Vivian, over 70,000 should have a fair rent officer to have residents have review their rent increases within their municipality. So it's now state legislation, but it wasn't prior. So we've been ahead of the curve for over 20 years.
So this is anyone's rent in any apartment that can go and come to the commission and.
Sure. And Vivian, she lives in this more than I do. You want to, add some a little deeper for that, please?
Absolutely. So the fair rent program or division, what it does is, one, it informs the tenant and landlords of their rights. But when there's a complaint, it really has to do with a fair rent increase, or if a landlord isn't doing the maintenance with the amenities or with the unit, and so therefore the unit price that's being paid is no longer fair. right? So there is some discretion, but there's 13 categories that are used in order to decide that. And there can be a hearing, and the hearing is legally binding. So if they wanted to appeal it, it would go to the courts, but it is a requirement, a state requirement at this point. But we were able to have the ability, like Chief Officer Lamont Daniels said, that we had it for a long time, and we're actually seen as one of the leaders in this division, because we've had the president and we've had fair rent in our department for a long time.
Okay, great, thank you.
And it's a great
Excellent.
service to our residents. It's highly utilized.
Okay, so with that explanation and detail, thank you again. Any questions related to any of the line items in the proposed budget? All right, shall we move then, Tom, to human services?
Yes, that's several over, some pretty significant increases here, but, we were expecting this and, yeah, just take it away, Lamont.
Sure, thank you. And then
or Anna Vivian.
yes, thank you. I'll start and
This is a
definitely
known issue.
I'll start and but just I think, because this also is public, again, just want to thank the mayor. This is a program that really started during COVID. It was funded through philanthropy, and Vivian will be able to share that. But more importantly, this was a program where philanthropy helped us meet a need of our 92,000 residents, and they made a commitment for over 3 years to fund this, and worked with us in Mayor Rowland's office to look at institutionalize this, because the need continues to grow. We are not a traditional social service department in that respect, but we have been highlighted and recognized through our colleagues throughout the state around what good government can do and how it can support its residents. I'm proud to say I was the architect of it, but most importantly, Anna Vivian, our human service director, has really taken to another level. And we're really excited to be able to maintain this program. As you know, last year, many members of the community, even some of the council members, have spoke of its importance and wanted the city to maintain this service, these resources for the community. And I know we want to move quickly, but just want to highlight this. And Vivian, if you want to just add quickly, I know we want to move and we have some other discussions, just to speak to this a little bit.
Absolutely. I'm sorry, did I hear someone speak?
I can hear you.
Please go ahead.
Yeah, so this was a private-public partnership, like Lamont highlighted generous grants from the Parent Astrid Heinrich Foundation and the Ritter Family Foundation. So really, it was at the height of the COVID. There was a realization that our residents, that our family needed assistance. And then since then, we realized that this filled a gap in the community where any Norwalk resident can come into City Hall. There's an online form, they can call, they can email, and they can ask for assistance. And we're a bridge to all of our wonderful nonprofits in the community. And so this is the year where we tried last year, and our partnership, they were generous enough to support us for an additional year. But we're really asking and supporting that the city absorb this as a foundation, as something that the city can continue for years to come. We were also recognized a municipal excellence award we received because of the impact of this program, and because of its importance and creativity to really meet the needs of the residents. And so this would absorb 3 full-time employees, and it represents 3 languages that are very important to the residents, and Spanish speakers, Creole speakers, and English speakers, to make sure that we can meet the linguistic need of our community, as well as that bridge to all of our local nonprofits.
Thanks.
And Anna Vivian or Lamont, can either of you speak to, please, the dramatic increase in the salary wages line? The $165,000 increase year to year, please.
Right, that's for that line item. So, Anna Vivian, I don't have it in front of me. That's for the 3 full times. And what is the salary based on the grade?
Oh, I'm sorry. I don't have the grade in front of me, but we were starting them off as the base grade. I think it was 7. But it's honestly, a very conservative grade. We're not bringing them in at a higher rate. They're coming in almost like an admin level, and
It's about 50, 55, I believe.
Mhm.
Yeah,
Mr.
I remember
Abrams.
seeing that figure.
Mr.
at some
Abrams,
point.
sorry.
That's
Yeah.
okay.
Yeah.
So that $165,000 represents 3 new add to staff.
Yes,
absolutely.
sir. And then the
Yep.
corresponding expenses, IT, computers, all that, each department absorbs its own. It's not all of it, but in this case, each department absorbs some of that stuff within their own department. We see the increases in the coinciding line items to support those individuals' technology needs and office supplies, et cetera.
And are those individuals now on board, or are they to be hired in the new fiscal year?
They
Mr.
are
Abrams,
still
if I can, Mr.
Yes,
Abrams,
sir,
I think
Mayor.
yeah,
Yes, sir.
this was fully funded or funded by the Ryder Foundation and the Dalio Foundation. Last year, because of budget crunching, we asked them if they would fund it for another year because they knew that we were going to carry the program on after the funding was no longer available. And I think Mr. Daniels and Miss Anna Vivian Estrella can probably tell you the success of this program and the fact that Dalio again and Ryder agreed to fund it one more year. And that's why you see the sudden increase because they were paying for it. Now it's shifted over to us.
Thank
Yes,
you,
sir.
Mr. Mayor.
And right, Mayor, just want to just make sure the parent asterisk. So you want to just share a few numbers, Anna Vivian, of how this is being utilized and
Yeah, so this year already, 706 households have already accessed the service. So 706 households have walked through City Hall's doors or reached out to us in some way to get connected to nonprofit providers in the community. And this is really meeting their basic needs. This is food, clothing, medical assistance, assistance to accessing city services and nonprofit services. And if you look at the individuals that are held within those households, we're talking about an impact that's over 1,500 of our residents in Norwalk. And that continues to grow. So year over year, we've seen more and more Norwalk residents access this service to make sure that they are getting the things that they are eligible for and getting the help that they need in order to continue to live successful lives and support their families.
I
Thank
just
you very
checked, they're the lowest grade in the union. We enter them in at grade 8.
Thank you. Questions from other members of the board?
Yeah, I've got a quick question. Oh, sorry, Ann, do you want to go?
No, you go.
What I'm hearing is that the service that's provided is basically you're like a referral source. Do you provide any services in-house or is it all sort of a referral situation where people come and you sort of point them in the right direction?
Sure. So I'm going to try to consolidate what it does. In our nonprofit communities are experts in what they do. And since the city didn't have a social services department till about four or 5 years ago, really we have a robust nonprofit community partnership. Where the city had a gap, I'll say, is that our nonprofits are experts at what they do. They're not experts at what the community has to offer and their partner agencies, right? Each person is in their own silo. And it is this office's, the Community Resource Hub's obligation and mandate to really be aware of grant funding changes, program funding changes. They're all have their own area of expertise, whether that's food, workforce, education, early childhood. And there's just no way to stay up to date with that if you don't have committed members of the staff to be in the meetings to make sure that they have the connections. So if one of our residents come in and they say they need food, it sounds like a simple request. It really does. But then when you start drilling down, do they have access to a kitchen? Do they have access? Do they have dietary restrictions? Do they have a mode of transportation to get there? It gets more and more complicated, the layers that go into each of those requests. So it is at its basis a referral source or a bridge to our nonprofit community. but I don't want to oversimplify it and just call it a referral source because it is much more involved than that. And we do whatever it takes to get the resident to those services, right? Does it mean helping them figure out the transportation piece? Does it mean seeing if we can have the nonprofit provider partner with us to get the services to them? So it's much more of a like intentional connection and partnership and collaboration with our nonprofit providers.
Thank you. I appreciate that answer. Thank you.
So I have a couple questions. One, is the Ryder Foundation and the Dahlia Foundation giving the city of Norwalk any further funds in any of their departments?
I just want to just say, I know the mayor mentioned Dalio. It's the parent asterisk. Dalio was the connector of those two particular organizations. I just want to make sure we give credit to the right organizations and the Ritter Foundation. So in terms of, I can speak to my department. The funding that, as the mayor pointed out, they are funding us until June 30th of the close of this fiscal year. But I will say, we continue to have great relationships with them to think about piloting or looking at other opportunities to support our residents. To Anna Vivian's point, this is why I believe we were recognized. What does good public-private partnerships look like? Sometimes government is not in a position to be innovative and try things out, but if we can get other people to help support us, and then see, did we make an impact or not? And I think what people have said and what we have learned and what our experiences have been, that the impact is there, the need has been there. And so through Mayor Rilling, we made a commitment to keep this service. And I might add, this is modest in terms of social services with our neighboring partners. We actually started out with 5 of individuals, but and Vivian level set it. Again, looking at our responsibility, this funding is taxpayers' dollars, and so we now looked at our numbers, the capacity, and so instead of 5 full-time, the recommendation is 3 full-time to support the work.
So again, I'm sorry, Lamont, are those foundations providing any other funding to any other part of Norwalk or any of your other?
I can only speak for my direct department. And so, as I pointed out, June 30th, this concludes, but they are very active in the city of Norwalk. They do a lot of other projects in the city of Norwalk. I'm just not prepared to speak specifically to say this is what they're doing, but they are most certainly known. Both of them are extremely known in the city of Norwalk to support a variety of programs, services to help uplift and fill the gap in the city.
And you said that now it's an additional 3, whereas it was 5 people before. How were those 5 people paid before?
Through this funding, through the Ritter Foundation and the parent asterisk funding for the past almost 4 years.
I understand, but on whose payroll were they?
They I don't know if I asked your question. So they paid the city and the city paid them.
So they were full-time employees on the city's payroll.
Funded by the foundations, correct.
But they were union employees.
No, ma'am.
Okay, but you said that you budgeted for level 8 on the union scale.
That would be July 1. So they're not union employees. The recommendation is to absorb them in the city budget as full union employees with the benefits of a city employee. They were funded through the foundation. They were paid by the city. Now I'm getting confused. The funding came through the city to pay. Yes, sir. Yes.
They were paid at the union scale, but they were not members of the union. They are grant employees.
Okay, so they weren't. Did their paycheck say from the city of Norwalk?
Yes.
Okay, so did they receive health and benefits from the city of?
Yes.
Yes, those who based on regular employment laws, those who requested it was able to access some of those services.
Yeah, Deanna, you may be able to chime in here. You have a similar situation every year with your grant funded employees, right?
Yeah, well, we do have The health department has had several staff members on grants in the past, just, like Lamont and his team have. And we have, for our employees, there's a separate union for grant employees specific to the health department that has been historical. But city employees, but funded through grants and different accounts that you don't see reflected in the general operating budget. There's separate grant accounts that are specific to each grant where the staff is getting paid from, but city employees.
And Tom and Jared, the numbers we see here for salary, are these fully loaded for health and benefits?
What you see is just the salaries. We have health and part of the employee benefits is all health insurance and all the other peripheral overhead charges. That's not part of what you see here.
And that is typically what, gross up of 30%?
A little higher. I want to say close to 40.
Yeah, it's around 40.
Yeah, and sorry, just as an aside, when we had ARPA funded employees, they were treated the same way within that grant umbrella, if you will. And if I'm not mistaken, there is an obligation for the city to offer them the same benefits that a union employee would get, which is why Deanna is often in front of the BET in the September, October timeframe, depending on how many of those grant funded employees want either benefits for a single person or a family.
I would just suggest that maybe there's a way that if they could be brought on as consultants or certainly potentially non-union, which I don't know the differences, but union sort of implies more obligations on the part of the city. But there's less encumbrance to the city for these employees, because this is a large amount. And I would also say first is how large of a non-for-profit community do we have in the city of Norwalk? Is it 30 institutions with $20 million of total funding? What's the number?
I would have to do some research. I don't know that off the top of my head.
Okay, so maybe since you're a valuable conduit to all of those institutions, and if there's 10 of them, perhaps each of them could kick in some amount, some less, some more, to continue funding these positions as a grant position.
I have a couple of questions.
Please, Ed.
Ms. Yang said that she doesn't know what the difference is between union and not non-union or whatever, but the difference is obviously that there's less protection and less benefits. But the question I have is there a corresponding line item in some other part of the budget that takes into account the additional 40% of health benefits and things like that? Is there something else in the budget that is there another place where the budget takes that into account?
We have an employee benefits section, Ed, where there's all the different line items, whether it's everything from the 401(a) matching contribution to health benefits to you name it.
Okay, so there is that. So these positions are accounted for in that part of the budget.
Yeah, and we don't push that back down to the individual departments and divisions. So we host it in a section called employee benefits.
Okay, thank you.
All right, so to try and summarize this and allow us to keep moving, Ms. Yang is making a suggestion, Lamont, to see if there are other grant sources of funding that can help reduce the burden to the city on that, on this salary. I think that's a fair and legitimate request. I'd ask that we have you look at that over the next several weeks and report back. At this point, Tom, let's leave this just as an open item from the standpoint of waiting to hear back from from Lamond on this, okay?
Okay,
Thank you.
All right, well, there's really nothing in senior services, so I think we can skip that one and go right to youth services, yes?
yes, yep. Youth services, is right here. We have a couple of line items that are not of significant dollar amounts, but some pretty significant in, percentage increases, and David Walenchek is here to, take any questions and address, his request.
Yeah, the main items that were differentiated from the pro forma in last year's budget is we're utilizing a new data collection system that the state has basically requested we use DCF, where we get our Youth Service Bureau grant from. It's called VOC, and a contract was done a couple of years ago. I know Anna Vivian was involved in that, and we're still finalizing an agreement going forward with them, but Anna Vivian had estimated that about $3,000 would cover the contract costs for us to use that system. They actually built a system out for us that we're utilizing, and so that's the $3,000 under other professional services that was not there last year. The other item was I think last year when Darlene Young was moved under our budget piece, her longevity amount didn't transfer in, so that was updated and corrected. I think that's the 585 number. And then the 51,326 was actually, I think, we had a position that was frozen last year under the hiring. We had a vacant position, and then the mayor had instituted a hiring freeze last year to kind of mitigate some of the budget concerns, being a tough budget year, and that position was not filled, and that's why there's that 51,326 number, I believe.
Thank you. Other questions for David? Okay, seeing none, let's keep rolling, Tom.
Okay, we're on to, Chief of Community Services, Lamond's area. Right here is the
That would be
salary
me.
adjustment. Sorry?
Oh, I'm sorry. I thought
Just give it a
So
quick
that would be
overview,
me.
Lamond. Just a quick overview.
Tom, I was
Um,
going to drop off if there's no more questions for my section.
I think you're good to go, David. Thank you.
Okay. Thank you. Bye.
So yeah, in the Chief of Community Services area, you'll see the salary adjustment that we talked about the last couple nights, where we assign the 1% reduction to the chief's area where possible. So that's a total of 59,000 for community services. Other than that, a modest bump for salaries for that'd be Lamond and Maritza, and pretty much flat across the board the rest of the way. All yours, Lamont.
Yeah, no, thank you. And you'll see a reduction in other contractual. Again, the mayor asked us to work with some of our partners, so we were able to negotiate some contracts. I'm talking about 21-20-10, 5298. And then again, the 1.5, that's our grants and contracts. We pay the Connecticut Institute, our Head Start grant, which the city's obligated for a $500,000 match. Also in that line item is $400,000 to the Norwalk Senior Center, our youth services and our mini grant program. So we haven't asked for anything above in that, just keeping it status quo to continue to support some of those contractual obligations and some of our mini grant programs.
Okay, very good. Questions for Lamond on the chief? Okay, seeing none,
Thank you.
let's move to health admin.
Lamont, you are not free to go.
I know that.
Onto health administration, just a handful of changes in this area. We have Deanna here to speak to that. Nothing significant to speak of other than insurance premium, but there is a good explanation for that. But without any further ado, Deanna, you can take it away.
Thank you, Tom. Good evening, everyone. You'll see the increase for the regular wages under health admin that are contractual increases and step increases. You'll see some deductions in some of the accounts. We worked with Jared and Tom to find some savings there. And then you'll see the increase, as Tom alluded to, insurance premiums, and that's related to the WIC program and the costs it requires in order to fully operate the program with a fully staffed team. In the past, we've had some vacancies, and so we haven't had to utilize all of the money we thought we would need, but we are fully staffed now. And we're going to journal entry soon some of the expenditures for this current year, but WIC is on a federal grant period, which is October 1 to September 30th. So sometimes there's some crossings of fiscal years, but as of now, we're about 33% within the grant period, and we've already expended 60% of our budgeted benefits, the money budgeted for benefits. And so we are going to, from the grant, so we are going to need to utilize the city operating budget to support this program in order to keep running it fully. And thank you to the mayor for all of his support and the BET in the past to support this program.
Okay, thank you, Deanna. Any questions for Deanna on health administration? Okay, seeing none, let's move to building maintenance.
Yeah, so these are all the utility accounts and basic services for running the buildings. Neil Rennie and his team on the facility side input these numbers, and these are all contractual, and we'll see these time and again across any of the departments that have city facilities. Are there any questions? Actually, I think yeah, Neil is on if there are any questions regarding these, but as I said, the vast majority, if not all of them, are contractual, meaning that they're obligated at certain levels.
Well, understanding that it's obligated, but can you give me just a little bit of an understanding as to why the buildings line is up almost $40,000
Sure.
year to year?
Yes, I can. Let me just also put my camera on for everyone. So we did some reallocations of so we have properties that come in and out on us. So 98 South, or which is going to be the new center over in South Norwalk. That's going to go offline for approximately a year. But we've taken other buildings in. We're going to be taking on the Matthews Mansion as they come online shortly. And then we did a reallocation among all the buildings. So it's appropriately based on square footage, we reallocated all those numbers. Nothing's changed as far as the bottom line goes. So we made adjustments in the building account and also for janitorial. We had the janitorial spread out across all the accounts, and we just focused it on the buildings that we're actually doing that work at.
Thank you, that helps. Other questions for Neil? Oh, excuse me. All right. Seeing none, let's keep moving.
All right, on to environmental health and housing. I think these next few are all under you, Deanna.
They
All
are.
right, well,
So
your
you'll
turn.
see the regular wages, you'll see that there's an increase there. That includes contractual wage increases, but it also, you'll see that increase because one of our positions was funded only half of the year due to the vacancy, you know, the decision for the hiring freeze. So that's one reason why you'll see that larger increase for environmental and housing. I do want to point out that we had requested one of our part-time staff members to be full-time, given increased workload related to follow up with children with elevated levels of lead in their blood, because the state has changed their mandates, and so we have to do more inspections and more follow-up. And so due to the increased workload, I had put that request in, but I understand the difficult budget season and difficult budget situation that we are in. So it's recommended for this next fiscal year to keep a part-time person and not have them be full-time. But we will continue to do what we can do on our side, given our resources to meet the needs of the community and the demands and mandates that are placed upon us by local and state lawmakers. I will point out that you'll see that eviction line, 5250. You'll see that there's a 50 increase, but then there's a corresponding decrease under 5617. And that's directly because of the BET's recommendation. They wanted us to move it to a line item specific to eviction. So you'll see that change. And thank you for that recommendation. And that's environmental health and housing.
Okay, any questions on environmental health and housing?
Yes, under non-tax revenue, there's 405,000 anticipated for licenses and permits. Is that revenue coming out of this particular department?
For licenses, yeah, we have revenue for environmental and health and housing, that group, as well as the weights and measures designation. So 01-2020 and 01-2023. So we
Okay.
collect licenses for food establishments, temporary events, septic, for and also our weights and measures program. We also can collect clinical revenue as well, but for licenses and permits, it's environmental health.
Your costs are roughly $1.1 million, but you bring in roughly about $400,000 in revenues.
And we work with our Board of Health to take a look at like what is the cost to provide the services, and we look to increase fees accordingly so that we're able to collect more revenue.
There's also roughly 250,000 in service charges. What does that relate to?
I'm not exactly sure which account you're looking at, but it could be related to our clinical services. You know, we collect revenue for vaccination. I don't know if you're looking at that.
I don't know, that's a big number for vaccinations. Maybe that's something Mr. Ellis or Mr. Schmidt might have.
You're looking at the budget book, right, Ann? The revenues?
The book.
Yeah.
What code is that?
Page 139 of the budget book.
We have an Excel. I have my Excel open.
I'm pulling that up now.
Yeah,
Okay.
one of the drawbacks of the budget book is it doesn't list the exact
codes.
line items in Munis to that roll up to that particular category.
What's the description you noted?
It says it's under non-tax revenues and it says service charges. So they're under non-tax revenues. There's intergovernmental of 68,000, licensing and permits for 104,000, or I'm sorry, for 405,000, and service charges of 248,348.
Sorry, I'm trying to pull up a document that has all of our revenue from last fiscal year to make it easier to pull up.
Yeah, because I don't see any commentary.
If Deanna can't find it quickly, would it be acceptable, as we did the other night, just to have this followed up on an
Yeah,
email?
I've actually got the breakouts here. It encompasses food licenses, other environmental, housing code fees, and housing violations. The biggest one by far is food license at about 260,000.
And so here would be a question is, like in code enforcement, are we missing on some fees because you may be trained? If you had more resources to be able to collect more, how is that? Is there a balance there?
Well, we certainly can look at our revenue, our licenses and permits, and we can do another analysis of it, and we can look to increase. We would do that with the Board of Health and the Common Council.
I'm not suggesting what I'm saying is say, for example, in building code enforcement or other things where we haven't had a person that would enforce building code, and therefore there weren't fines that weren't the city wasn't collecting because they're just staff. So my question to you is really more, are you fully staffed for the need? Or are you understaffed because you're just not getting around to some things? It sounds to me like you're fully staffed to do the work you need to do. So that's my question.
Well, I will say we've had a vacancy, so we're definitely we're not meeting all of our mandates. I will say that. We're not meeting all of our food establishment mandates, inspections. And because of the increase in follow-up with lead, and because over the years we've had, additional ordinances and state statutes. And so we do our best, but that's why we had requested for a full-time staff member, but we are not at 100% of meeting all of our mandates.
So I guess my question to you is can you go back and just take a look at your business model and say, okay, we're not getting to everything. And so we have the full staff. Can I self-fund that additional staff through the permits and violations and the revenue we could be getting if we actually have full staff? So my question is, can you just be self-funding to get your where you need to be, and you fund it yourself through the additional licenses and permits that you have the capacity to then issue? So it's just for you to go back and just take a look at your business model and think about.
Thank you. I appreciate that advice. Thank you.
Okay. All right, shall we continue to move then?
Under weights and measures, Deanna?
For here, this is mostly just contractual increases and like some contractual longevity payments.
All right. Questions on this department? All right, shall we move to community health?
Same thing for community health. You'll see increases in regular wages because of step increases. You'll see a longevity payment in there, and then we did have some savings in the membership and dues.
All right, very good. Questions on that? If not, let's move to health laboratory. Again, there's really not a lot of expense here at all. So questions on this? Okay. There's no expense associated with senior services coordinator, so preventable diseases.
So here is where we put in a request for an additional staff member, to fund a public health nurse through the operating budget, which has been recommended by the mayor and the CFO. This brings us back to the discussion about grants. We were able to utilize funding that was given to us through the COVID-19 response and also past grants to support a grant-funded public health nurse who is able to increase our capacity, to be able to provide more childhood immunizations, to be able to respond to latent TB infections, to be able to provide, more like routine vaccination, as well as supporting some of our sexual health services and other things. One of the grants utilized to pay for that person is ended. Another one is ending. It's going to end next fiscal year. And then another one is being proposed, being cut by the state by 10%. And it also is used to fund other people as well. And so talking about funding, we've, as people have followed, if you followed along to what's going on at the national level, a lot of our grants are from federal sources. Often it's passed through from the state health department, but most of our grants are federal funding. We were ordered to pause our spending this year because of some of the changes. And there's court cases going on. We're working really closely with the state health department on figuring out, which grants to continue, keep maintaining, the staffing that we can, looking at other expenditures. But there's a big question mark on, where we're going to be with these grant funds. But we do know that the ones that were used to fund this full-time grant-funded public health nurse, we're not going to have them, and we know that we won't be able to support it in any other way unless the city is able to fund that person. And so we want to be able to meet the needs of the community. We want to be able to deliver critical health services. I really want to thank the mayor and Lamond and the BET for all the support that you've given this health department. Over the years, public health funding fluctuates. We've lost staff over the years. We've been able to gain them back. So I just really want to thank you for your support and ensuring that we can do the important public health work for this community.
Thank
You'll
you,
see a
Deanna.
correspondence as well for the part-time to put an increase for additional wages there.
Well, the health of the community is one of our greatest priorities, making sure that we provide the services that they need.
Thank you, Mayor.
Great. Any questions for Deanna on this?
Where is the overlap on what the city does and the people on the city's payroll? And say, for example, the community health, which I know is independently run and granted, like that's up on Norwalk Avenue across from the fire department. And I believe that we provide grants to that community health center.
Yeah, they're a federally qualified health center and they receive a lot of funding from the federal government as well as the state. We have two FQHCs in Norwalk. We work really closely with them and we do, all of us, the three, and as well as the school-based health centers have increased capacity over the years to meet the demands and the needs of the community. So we're all doing our part to increase the demands and to increase the capacity. Even with that, we actually we had a recent study about immunizations, and even given some of the increase in the increased staffing, we're still seeing the public report to us limited availability or having to wait a long time to make an appointment in order to be seen by a provider. Providers themselves, there are shortages within the community. There could be difficulties in scheduling appointments, challenges in catching up, which children catching up to their recommended vaccination schedule. So even though we're all working and looking at additional funding sources, there is still a great need in the community.
Is there merit to have those services be with maybe one of those community health centers rather than us individually, our city health department?
So we're a small part of it, right? The community health centers are doing the work too. They're offering child immunizations, and so are we. We do have like our niches in certain areas, like tuberculosis care. We work really closely with the hospital and AmeriCares and other providers on that, as well as sexual health services. We have a real expertise here within public health, within the local health department. And we do outreach to other providers too, to provide education to ensure that, for the patients that they're seeing, that they're doing it in an evidence-based manner, and they're, so there's a level of the education and promotion as well as the direct patient care too.
Nothing else.
All right. Any other questions for Deanna? Deanna, thank you. Really appreciate it. Tom, shall we move to library administration?
Yes, we have a handful of changes here. Don't forget, there are several sections within the library. There's library admin programs, and then there's the main library maintenance. And finally, we will close with Sono library maintenance. The vast majority of those maintenance line items are under the facilities jurisdiction. So anything on that side, Neil is still on, he can address. But with that being said, Sherelle, why don't you take it away?
Can everyone hear me okay?
Yes, ma'am.
We got you.
Okay. Hello, everyone. Good evening. So our asks are pretty minuscule. The two are in our grounds section. Account number 5265, and that's one of them is contractual. We'll enter into another agreement with the Eagles for parking this year, so that's contractual. And then the other is for our grounds. Neil provided Lamont with an estimate of $15,000 for landscaping and plowing, and things like that. So, the ask is an additional $25,000. And
Sorry,
then
Sherelle, yeah, Sherelle, where's the Eagles lease? What line is that?
that would be 5265.
Oh, it is, okay, all right, I thought we had a rental or something like that, but that's fine.
So those are parking space rentals for
Yep.
parking spaces. And it went down. We originally rented 30 spaces, and the next fiscal year we'll rent 13 spaces. So the amount did go down a little.
Sherelle, this is Troy. Is the 25,000, the parking spaces, is that the Eagles lot or is it the new lot you just bought?
It's the Eagles lot.
So why are we still paying for that when we have you picked up the new spot from Milligan or whatever recently? And you have the spots around the corner where the Norwalk redevelopment agency is.
When we have programming, both lots are totally full. And at the time, we were thinking about renovation, that we may have to take some parts of the parking lot, and we would need the additional.
So how long is that you think you're going to be using the Eagles lot? Another year?
It could be another year, just depends on how quickly things move and what the outcome is of renovations and things like that. So it's a 2-year contract. So it could be 1 year or it could be, 2 years. We're anticipating 2.
Okay. And the other question I have is on other contractual services. I guess it's 5298, about it's 88,000, it was always very small at 2,000, 2,000, 2,000. Now it's up to 10,002. Just a little color on that, if you don't mind.
I'm sorry, which item?
The org is 1610, your 16210, and then 5298, Tom. That's the line, right, that you use?
Right
That's
there.
the maintenance. That's
And
the
by the way,
library.
this is going to come up a couple of times in the next couple of pages, and other contractual services, and it's just, and numbers are dumped in there. I just want to get a little more color.
Tom, that's the maintenance division.
What's the org code again?
5298.
16210, 5298. Neil, is that one of yours?
Yeah, that's not 16210. That's not us.
So I'm looking through. So the only thing that, again, you'll see across all our accounts is just the reallocation of funding across 2 accounts, the building and buildings account and the other contractual services. But you'll see our bottom line has not really changed. We're getting 2.6% across our total budget.
So Neil, is it possible to get for the board, all of that summarized line item change that you're talking about, so that we don't spin ourselves every
because
time we see
you're going to
another
see it.
contractual services
You're
number?
going to see it over the next couple of pages.
Yeah,
Yeah, it's just a reallocation. So when one building comes offline, we obviously that we haven't changed. We pick up another building. So we really just change the amount for each building, right? The percentages. We did a true up this year based on square footage. So
right.
you
No,
get,
I understand.
yeah.
Right, but seeing that summarized, because to Mr. Jeller's point, right, we're looking at it for library maintenance
Yeah.
and seeing an 88% increase. You're saying there's an offset somewhere else because it's a reallocation. It would just be helpful to see that whole set of reallocations summarized so that within each department, we don't have the same discussion.
Yeah, it's the same. It's a common thread across every account. So we can get that to you. Yes.
Thank you.
Yep, no problem.
Yeah, good, because you'll see it coming up. So
Yeah.
So just as an example, Neil, we should see if my memory is right, we should see a reduction on 98 South Main when we get to the next page.
You definitely do.
Okay,
Definitely do.
yeah, I think
It-
that'll
it-
help clarify.
Yeah, so that's a building that goes dark and then comes back up in the I think the second half of the of next year, or would be our going into our final quarter of next year. So there's some juggling going on there.
Okay. Actually, yeah.
I'm sorry, I was gonna ask if there were other questions for Sherelle.
Next door maintenance.
I don't think there are. Does anyone have, I know we were in the middle of library administration and programs, but Troy, you jumped down to some of the maintenance, and that's fine. Are there any questions on any of the other maintenance line items? Or on the administration line items? Okay, seeing none, Tom, I guess we can keep moving here.
May I,
Yeah,
may I make a statement? Just a quick statement, please.
Please.
Thank you. So I noticed, last night that there was a cut to our part-time budget, and I am asking that we reinstate the 50,000 that was cut from that budget. And the reason being is, so I sent a summary and I can send this to you as well. There was an article in the Connecticut Mirror, but we all know that the minimum wage has increased in increments. And this January, it increased to $16.35. So our shelvers, who are at minimum wage, that's what they're making. But we have, full-time library staff that are making $17 an hour. So it's 65 cents more than they're making. So I had proposed salary increases based and for part-time who have not had any raise since 2012. Basically giving them $2 raises if that's what we can sustain, or $3. According to our benchmarks for Connecticut, we are really lagging behind in what we pay our librarians. And again, I don't want to take up all of your time. I can send this information to you. But we've also noted that surrounding libraries, their library assistants are making more than what our degree librarians are making. So we were tasked with trying to find these increases within the current budget. And so my ask is that we please not make that $50,000 cut.
Understand the ask. On behalf of the BT, I'm not going to commit to reinstating that tonight, Sherelle. Tom, we can keep that as an open item as we look at our full deliberations. If we find other ways to do puts and takes, we can come back and reevaluate it then.
Yeah, and we, Ed, we, in looking at the library budget over the years, we noticed that there were some under budgeting throughout the years, and so that's why we made the reduction to the part-time staff. And if Sherelle wants to come forth and give us a number and give us an estimate of how much it would cost to provide those increases, we would, we would be willing to look at it from the administration standpoint and give our recommendation about whether or not we could do that and possibly do it and still make this reduction of $50,000. So I'm happy. We're happy to look at that, but we need the information. We need to have those details to be able to evaluate that.
Jared, should I send it directly to you? When I send the information, I do have it, so. I'm not,
Get that to Jared and Tom. Yes, Jared and Tom will then share it with us.
Perfect,
Yeah.
okay.
Mr. Chairman,
Yes.
1 minute, if you would. I'm getting a lot of background noise. I think people that might not be unmuted or might be muted, unmuted. And if we could ask people who are not speaking to mute until they want to have comment.
Absolutely, Mr. Mayor, thank you. Ms. Yang, I believe you wanted to make a comment?
Yes, just quickly, Cheryl, in the part-time people that you're looking for an increase in wage, are they part-time and they do not receive benefits from the city?
They do not receive benefits, they're strictly part-time.
Yeah, I get it. Thank you.
You're very welcome. And thank you all for your consideration.
Thank you, Sherelle. All right, Tom, should we move over to Operations and Public Works and Rex and
Yes.
Park?
Thank you, Team Community Services.
Thank you. Have a great evening. Thank you. Have a good night.
All right, on to Operations and Public Works, which is inclusive of building management and recreation in parks. We'll start with the Operations Chief, which is Vanessa. And let's take a look and see what they have here. Salary's easy, 2.35%. And there is that salary adjustment that we've spoken a bit several times now. And other than that, it is relatively flat in the Chiefs area, except for seminar and conference fees and transfers to other funds. Do I see Vanessa? Are you on? Thought I saw her name somewhere. I see a conference room with Vanessa that's muted.
Can you
There we
guys
go.
now?
All right, we got it.
Okay,
Okay.
perfect. Thank you. So good evening, everyone. Vanessa Valadares, Chief of Operations and Public Works. Thank you. I know everybody's tired. It's your third meeting, and I believe that we're the last one of the week. So we'll try to simplify and make sure that you guys can go home earlier. So before I start, I just want to remind that under Public Works, we have for the operating budget for divisions that will be operations, building maintenance, engineering, and Rex and Parks. This year, we were extremely mindful of the request that we received from the mayor to really keep our budget as flat as possible. And throughout all the divisions, we really spend a lot of time to keep it like that. The only areas that you will see that we couldn't keep it flat was when we had a big impact, a contractual impact. And in that case, particularly on the operations side, was related to our solid waste new contract that will be effective as of July 1st. But besides that, we really try to be extremely cautious on all the requests that we did. So everywhere that we could keep the pro forma, we did. In most of the divisions, we are not adding personnel. There is just minor adjustments on the part side related to some already employees that are here that we have that same situation that the grant is about to finish, and then we need to observe some of that into our operating budget. But even that, we came up with some ideas to really minimize the impact on this budget. And even though we did all that, I think that overall we came with a total of 5.33% throughout all the divisions. And again, and the reason why that number is a little over is really because of the operation budget that is about 6.82%. And that is directly impacted by the solid waste contract and the transfer station. Just to put in perspective, building maintenance came as the lowest with only a 0.72% increase. And Recreation and Parks did their magic, and they came as a 258%. Here we have new online, as you guys saw here with me. We have Rob Stowers and Ken Hughes for Recs and Parks, and Chris Storr and Deline Bird for the operations side. And I'll be able to answer any questions related to engineering. I ended up not bringing Jimmy onto this meeting because the engineering operation budget is pretty much a flat budget. We went with the pro forma. So with that, I'm happy to continue as you would like. Let me know how is your preference, and we can go on answer some questions.
Thank you, Vanessa. I think we'll go kind of department by department and see what questions the team has. I have one as it relates to the operations chief department, the $93,000 increase on transfer to other funds, object code 5650. What's driving the significant increase there, please?
I'm just trying to find that one. Can you put on the screen for me, Tom? Can you locate
Yeah,
that one?
I've got it highlighted. This one right here.
Oh, this is what it is how we paid our bills. I believe that this is the one that we ended up transferred to pay some of the sewer fee and all that. That's what it is. So it's it's just really the cost of the sewer that we ended up paying for the WPCA in all the buildings.
I think, Ed, how, and everyone, you get, when you get your property tax bill, you get a component that's related to the sewer. This is the part that is related to city buildings. So we pay for sewer, or this is where we pay for sewer for the city hall, for the DPW center, for all of the city facilities, in addition to the allocation that we pay to the WPCA. I don't know the exact split, but it's probably about 400 to 200, roughly.
Thank you. Any other questions from the board on the operations chief department? Questions related to the operations department?
The board book, the book that I have, it doesn't break it out, but I do have some questions on the overall, because Tom, in this book, in the personnel summary, it doesn't show what was the personnel for last year. Those are all shown as zeros. So I guess my question then to Vanessa is just overall, what is your increase in headcount? Is it 3 people or is it 2 people?
Well, we only have the increase on the Recs and Parks side. We are actually even keeping to try to hold this budget under the operations side. We still are keeping one position frozen to help alleviate a little bit that increase. So again, throughout the board, we can kind of really keep it low. So there is no increase on engineering, no increase on operations. And there is one person, right, that will be coming on, that will be the finalizing the grant, right, that we're going to observe.
Yeah.
Right?
Yeah.
Okay. So I guess we could move on to whatever is next.
So no other questions on operations. Anything on sign and markings? There's very little expense there, so I wouldn't expect any, but snow and ice removal. I know we squeezed you last year on our salt supply. I assume the $225,000 is to rebuild that stock. Is that a fair assumption?
Yes.
And
Other
hopefully it will
questions?
be enough, because this year we ended up with 11 events, right, Chris?
11 events
So
and
far.
2,700 tons of salt we used so far this year. That's not just DPW, that's all of the departments that get salt from us. And we do get reimbursed for some of that back.
Vanessa, Chris, and perhaps even Neil, do you want to chime in just real quick on the condition of the shed and how that's affecting your ability to stock stock salt when it's at a really good price?
Yes, so I'm happy to talk about it because that is one of the items that is also showing in our capital request. Last year, well, for a couple of years, we knew that we had to do some like repair work at the shed, and then building maintenance ended up having that money in last year's capital budget. So when we came to do the work, for our surprise, the condition of the shed is much, much worse. We had to hire a structural engineer that pretty much told us that we need to replace the shed now. So because we didn't have the money, what we ended up doing is we reduced the footprint inside the shed for now, adding some concrete barriers so the loader doesn't press against the wall that is compromised. So we couldn't fill as much also the shed this year, right, Chris? We had about what percent?
Yeah, so our shed holds 7,000 tons of salt. And over the last couple of years, we've maintained about 3,000 to 3,500 tons of salt, knowing that we needed some work done. We just didn't know the work was gonna be a complete new shed. So again, this year, we're trying to keep it low, hoping that we come to a resolution for the shed sometime in the off season this summer and can restock the shed next year, to your point earlier.
But just to give you some numbers, 7,000 tons, we are paying 115 this year on each ton of salt. And each storm, we are using between around 400 tons, like in average, depending, of course, some will go a little less, but some we can go much more. So just so you guys know, as of now, we have spent over pretty much 4,000 tons of salt at the good thing is that we didn't pay on all of that, the 115, because we had some stock from last year's. But that's why even though it is 225, it is a conservative number. So I just want to let you guys know.
Thank you and understood. Other questions on snow removal? Any questions related to the storm drain department? Solid waste? Again, I assume this is where we see the contractual commitments for the new removal contracts.
That's correct. And although you're seeing that we ended up rebidding the whole contract, and on the overall, it will be some savings to the city. We're expanding a little bit the service that we are giving to the residents, but particularly on the solid waste, one thing that we did, we are using now, we are changing the totems, so the containers that all the residents will put the solid waste within the 4th taxing district is a specific one. And with that, our vendor will be able to use automated trucks, so we'll be more efficient, and we ended up seeing a reduction on that cost. One thing that is still driving the price up on solid waste is the recycle. We do not make any more money on the recycle. We are paying to get rid of it. So that's why what before used to become pretty much a revenue on our end, now it is expense. And we do not charge the residents, so this is not taxable for recycle. It is the solid waste itself within the 4th taxing district it is, but the recyclable is not, and as of now is adding cost to us.
Okay.
And Vanessa, on the increase in the recycling costs, is that greater tonnage or just greater dollars per ton?
What happened, Ms. Young, is that unfortunately, since COVID, the market for selling recyclable pretty much do not exist anymore. Before, all the recyclable used to go to Asia, and now that market is not there. So, and that's why they were buying everything. So it was great because we really pretty much sold. And that's the reason why the city many years ago decided to expand citywide, because the more recyclable that we were collecting, more revenue we could add on. Now it totally changed. We do have some hope, maybe not again with the Asian market due to everything that has been going on. But one thing that we have been seeing is that this burdening has been feeling by all municipalities nationwide. So there is a lot of companies trying to reinvent the recycle market internally. So it will be possible that in a couple of years, there will be some internal market that will start buying recycle again. We do get a little bit of a revenue on our contract, but it's only now 80% of whatever we call the fair market that they sell. So it's not everything that is able to be sold. It's usually the cardboard, some of the plastic and the glass. So with that, with our contract, with our vendor, we get 80% of that revenue. But before we got it like 100% of flat fee.
Okay, all right,
Thank you.
that's fine.
All right, any questions on tree maintenance? Okay. Seeing none, let's go to engineering. Any questions there? All right, any questions related to disposal? All right, you spoke to the recycling line item already. Anything on central fleet management or maintenance, excuse me?
Well, did you go past disposal, Ed, or?
Yes, I did.
Well,
I
yeah, it's
didn't,
another-
I asked, nobody said anything, but
I'm sorry.
go back
That
to
other
it.
line, that's another line item on the other contractual services of $227,000, so.
Yeah, this is not related to Neil. This is similar to same story as what you just explained on the waste side, right, Vanessa?
Correct. It's exactly that. The only item that we had a little bit of more than, but it's not enough money, is really on the other professional service that is the extra cost that we with other municipalities, we hold the hazard waste day, where people from New Canaan, Wilton, Westport, Stanford, right, I believe that.
Greenwich.
And Greenwich, each one holds one event. And there is a new contract for this year, and that's the price for it that went up. But besides that, we're just keeping exactly where we are. One thing that I want to just also that sometimes we did a big cleanup on our budget related to wage and fees, because we have, particularly under operations, we have about over 70 people working there, and they are under some of those, let's say, departments, right? So in what we ended up doing is, for instance, all the weight masters are under whatever it will be related to the disposal of solid waste. The crew that really just work with our CCTV camera, we ended up moving it under the drainage. So we have been doing that for a few years, and then there was a couple that we ended up changing. So that's why sometimes you see an increase on one, but if you go back to where was the original, there was that decrease.
Okay, thank you. Any other questions on disposal? Fleet maintenance, any questions there? I'm gonna skip the treatment plant because there's nothing there. Building maintenance? Okay,
We
engineering,
just, I'm sorry to interrupt you. we sent over a spreadsheet to Tom that he can distribute to everybody to clarify our allocations across all our buildings, so.
Thank you very much, Neil. Appreciate
Hopefully that's
that.
helpful.
I'm sure it will be. Thank you very, very much. All right, do we want to start to any other questions related to building maintenance? All right. Any questions related to engineering at North Eli before we go to Roosevelt? Any questions actually on any of the engineering lines? Quiet group tonight. Everybody good on 3 Belden Ave? I guess my only question on 3 Belden Ave is those are pretty substantial increases on utility costs. Is that because that building just came back online?
Yeah, we just picked that up in, what was it, July? I think like June, July of last year. So we didn't have any good information. We were only given partial information. There's multiple electric meters over there. So therefore we had to go up in our funding. But it's all utility.
Okay. Thank you. Any other questions for Neil on any of these line items? All right, then Tom, I guess we can move to Rec and Park.
Yeah, this will be the final department for the evening. And we have Robert and Ken, I think. Yep, they are in that same conference room there, which I assume also has some leftover sandwiches for me. Yeah. Starting with their salaries, they're up 111,000. One of the contributing factors is the half year versus the full year that we've talked about on a number of
Can I
occasions.
start, hey, Tom, can I start off just with the?
Yeah, go ahead.
Rec and Parks in fiscal year 26, basically what we've been doing probably since I've got here, basically, is reprioritizing and looking at our priorities all the time, trying to come up with really what we've considered a kind of a budget neutral budget. And here, we're going to continue to provide our recreation programs, our youth camps, our sports, and also our maintenance services for our grounds, for our playgrounds, for our ball fields, and for our facilities. So that's pretty flat in terms of not much changes there, except for the new community recreation community center that's being built, but that's not due to open until after the third quarter, around the third quarter of the fiscal year. So you'll find in this budget that basically our concentration or our efforts are to prepare for that recreation center. So we've allocated a 3/4 position for recreation manager to plan and to run that center. And they won't come on until probably around November because we only have 3/4 of the money. And also there is a position that we've been very, very happy to have, and it has been an asset to the city, and that's our arborist horticulturalist that we hired a year or more ago. And so we're going to be, because of the demands of the city and because of the use of this particular position, she was hired on ARPA funds, but will come off of ARPA funds at the end of the year. And so we have a half a year of funding for her to go full time. So those are the concentration really is on our maintenance and particularly with some emphasis on our trees. We're working on the tree master plan right now that we're completing this spring. And this person has been an integral part of that, and an integral part of working with DPW and the rest of the city and the rest of our stakeholders in terms of the urban forest and things that surround that. But you'll find in our budget, there's very little increase. We came under our submission and we continue to try and do that. So I'm open for questions.
Excuse
Ken
me.
and I are open, yes.
Thank you, Robert.
Yeah.
Questions for Robert?
So if so you're on a personnel basis, you're flat year over year with the exception of a half a year for your arborist. Is that correct?
Arborist, and we're bringing on a 3/4. We've got 3/4 funding for the new recreation manager that will be over the new recreation center that's being built on 98 Main Street.
Oh, okay, and that person is in your budget, and that's a full-time.
The funding's in our budget.
Okay.
Yeah.
And
We
full-time.
don't have that person.
We don't have that person
Yes.
yet.
Ideally, I just want to explain that is that usually we cannot just hire for that position after we open. We need someone that has to be on board in advance. So they need to start preparing for it. So that's why we are asking for 3/4 of the year for that position under that. One thing that will happen also, remember that the community center will also add more revenue under the Recs and Parks because there will be more programs that we're going to be able to offer there. So although there will be kind of this extra costs at the beginning, the way that we are projecting, probably whoever will be working there will end up being not a burden on the operating budget there because there will be revenue that will going to be created with the opening of the community center, correct?
Yes, yes.
So with expenses of $5.2 million, what is your revenue for Parks and Rec?
Tom would have that. Tom, do you have that? I think it's about one.
It's about 1.2 for this year. And I think we put in about 1.5 for next year.
And so you expect to get $100,000 or $50,000 in revenue from the community center to fund that position?
We have I did a projection, but it would be a whole year projection. Yeah, and it would be at least that much. But there is a projection in our business plan.
What's the biggest portion of your revenue? Is it camp fees or is it
Parking and facility rentals. But right now, we have our mansion is offline, so we lost, I think, close to $100,000 there.
Yeah.
But we expect that to be back online probably sometime next year.
And the parking is beach parking stickers? What is the stickers for?
Non-resident parking
Non-resident parking.
at the beach.
It's at Calf Pasture, Vets Park, and at Cranberry Park.
Okay, great. Thank you.
Any other questions for Robert and the team related to the recreation and park budget?
I would like to say, Robert, thank you for being fiscally responsible and trying to keep it flat to under and think about revenue offsets to expenses. Thank you.
And Ken Hughes as well. He's the one that
I'd like to thank Robert also. I see the 2.5 budget was very fiscally sound. Thank you.
Absolutely. And Robert, I did hear your credit to Ken, and so thank you, Ken, as well. But as a department, yeah, you guys, thank you for adhering to the guidance and for thinking about this as responsibly as you have. I know it's not just the two of you, but you can take the credit back to the rest of the team.
Yeah,
Thank you.
Thank you.
All right, thank you very much, everyone. Before we close, any additional comments from any members of the board?
I have a comment. I would like to propose that we put on the open items, or I would like to see a personnel list of all the new head ads for each department, and then whether or not those ads are related to grants running off, whether it's ARPA funding running off or grant funding running off. Because in the first half of this discussion, there were four head counts that were looking to be absorbed by the city of grants running off. So, and then there was discussion here about the arborists running off. So I would just like to see what that list looks like, and for us to be us as a board to evaluate absorbing new positions based on grants running off, because we're going to see more of that as we move along, and as Trump and the federal government decide to stop funding a lot of things, which local governments will have to pick up. So I just want to make sure that we're aware of all the extra things that we might be picking up because of the loss of federal grant funding or other funding.
Yeah, we have that, and we can pull that to, pull together
Noted.
something consolidated. But what I will say is the four you heard tonight are the only four. There were none the last two nights. When we meet again on Tuesday, the 18th, that's finance. There won't be any there. And then it's on to the grants. So there were more asks that we already recommended not be pursued before we even got to this point. So we whittled it down to four from an original of more than four. I'll leave it at that.
I understand. Thank you for thinking of that well in advance.
Sure.
Okay, any other comments from the board members?
Yeah, Mr. Chairman, again, thank you. I really want to point out that the city side kept within that 2.5 recommendation or mandate that I had, and they've done a great job. Now, that in spite of the fact that we are still in negotiations for at least 4 contracts. So that's still not going to change. The 2.5 is going to push forward, and we appreciate the department heads for all the work that they did in trying to do that. We know that this is a tough year, like I say every year, but this is particularly tough, and they've done a great job. As far as the grant-funded people, excuse me, as far as the grant-funded people that when the grant run expires, our policy, except in very rare circumstances, the position expires as well with it. We just can't take on, and the department heads know that. Now, obviously, a person that's part of the department, it becomes friendly with everybody and knows everybody and does a good job. There's always that, hey, can we keep that person? And unless there's a critical reason for doing that, we don't opt for that.
Great, thank you.
Mr. Mayor. Okay. With that, may I get a motion to adjourn, please? Thank you, Ms. Yang. We are adjourned at 8:10 p.m.
Thank you so
Good
much.
night,
Have a good
everybody.
night, everybody. Thank you.
Thank you. See
Have
you
a good
on
evening.
Tuesday, the 18th.